Brain Cancer by Amy Marie Bremner. I will be covering the background, signs and symptoms, risk factors, locations, effects of the disease, diagnosis, grades, treatment, and statistics in this presentation. Brain cancer is a malignant tumor that grows in the brain. It is part of the CNS tumors, which is the central nervous system. Rarely is it the primary cancer. It's usually an offshoot from a previous cancer diagnosis. There's over 130 types, and it does not have stages. It's measured in grades, and it can strike anyone of any age. In the photo, you can see where the brain tumor is all lit up in the far corner of the image. Signs and symptoms. Symptoms. Headache and worsening pressure in the skull, almost like a sinus infection. Vision problems such as seeing double or unable to judge distance. Speech problems, personality changes, dizziness, confusion, losing balance, and seizures. My mother-in-law actually had brain cancer, and how we found out was she couldn't judge distance while driving. She nearly crashed her car twice into a center divider, and that's how it was like the first sign that something wasn't right. So something as simple as that is, poor choice in judgment and unable to notice things that we would normally see are signs of brain cancer as well, and definitely warrant a visit to the doctor. Risk factors for brain cancer. Age, where it is more common in young children and older adults, usually around 65 and over. Men are more likely to develop brain cancer, but some tumors are more prone for women, such as meningioma. Exposure to solvents, pesticides, and vinyl chloride can increase the risk, although there is still scientific evidence, being discovered to support this. Family history, certain types of diseases make you more prone. Viruses such as mono or an infection of Epstein-Barr virus increase certain types of brain cancer because they inflame the lining of the brain. And electromagnetic field exposure. Brain tumor locations. Meningiomas form in the meninges, which is the protective lining of the brain. Pituitary tumors develop in the pituitary gland, and medulloblastoma tumors arise from the cerebellum or the brainstem. Skull base tumors grow on the underside of the brain, called the skull base. Other tumors are described by the cells of which they are made of. Effects of the disease. Location of tumor can cause different effects on the body. Choroidomas build up pressure inside the skull and can cause swelling behind the eyes before being discovered. Gliomas grow in the upper part of the brain, but can end up on the brain stem, which will not allow for surgical intervention due to risks of the patient. Brain cancer in a young adult can affect their growth, leaving them stunted or short for the remainder of their lives. There's a show called Shauna Rae where the girl actually had brain cancer, and she's about the size of I think around a 12-year-old, and she's 22. It's really wild to see, and it does happen in some cases. How it's diagnosed. Neurological exams such as an eye exam, coordination for balance, strength, and reflex tests can see what parts of the brain are struggling. A brain MRI uses magnets to create images of inside the body, and the dye makes it easier to detect the small tumors that other tests may not pick up. Magnetic resonance spectroscopy can measure certain types of chemicals to tell a doctor what type of tumor that they're dealing with. Positron emission tomography scan, also known as a PET scan, uses radioactive tracers to attach to cancer cells so that they stand out on the scan to become more visible. They will also usually do a brain biopsy in which they get a sample of the tumor for further testing. They can either use a very long needle, but in more complicated cases, a small hole is drilled into the skull to get a good sample for further lab testing to tell what type of tumor it is and the grade. Most cancers are judged by stages, but brain cancer is judged by grades. The grades of brain cancer consist of grade 1, where tumors are slow growing and not likely to spread. These can be cured with surgery. Grade 2 is also less likely to grow and spread, but more likely to come back after treatment. Grade 3 is more likely to have rapid dividing cells, but no dead cells that grow quickly. And stage 4 is where the cells in the tumor are actively dividing and it spreads very quickly, and this is your more aggressive form. The treatment is usually steroids that will bring down swelling in the brain to improve neurological symptoms, surgery to remove the tumor and the tissue around it. Some surgeries are done with the patients awake to avoid causing damage to the patient during removal, in which they will actually talk to them. Radiation to shrink it. Chemo will keep the cells from growing and multiplying. The survival rate for 5 years is 36%. The 10-year survival rate is almost 30%. The best way to prevent it is to avoid smoking and environmental factors such as radiation, eat healthy, stay current on your medical tests, but remember, it can strike anyone at any time.